Hey guys, just a reminder, this is not official medical advice. For such, please seek an appointment with a licensed medical provider.
Hi, this is Dr. Tom Rogers at Performance Medicine, coming to you with a weekly podcast, The Common Sense MD. I have a special guest back again this week because last week's episode was so amazing, Marcos Garza. He is an attorney extraordinaire, good friend, great lawyer, just great person, great dad, great friend to people. But our talk last week was so interesting about power of attorney, wills, medical decision making. So today I wanted to get you back and talk about patient rights. By that I mean, as a patient, what rights do you have when you go to your doctor or you get in a hospital? You know, that really became a big question to me during COVID because we saw so much controversy over you couldn't go in a hospital, visit your granddad who was dying of COVID, or you may not even be able to walk into your doctor's office if you didn't have a vaccination, or your doctor, and I saw this, would not be your doctor if you weren't vaccinated for COVID-19. There was a lot of really censorship type things, prejudicial type things. It's been my firm belief as a doctor, especially since I've been practicing 38 years, the older I get, the more I think this way. But I really think that the patient is the one to make the decision. And I approach my practice that way here in my office with patients. It's their decision. I'm a coach. I'm an information giver. I can examine them. I can give them my opinion. But it's my firm belief in the end, it's their decision, whether they want to get a vaccine, whether or not they want to get chemo, whether, they have a right to refuse treatment. That's my firm belief. And I think as doctors can sometimes get a little arrogant, a little hard-headed, their way or the highway. And I've actually seen doctors dismiss patients because they didn't want to do what their treatment plan was. But in my opinion, that's no reason to get rid of a patient. I mean, work with a patient. This is a human being. So I want to get into this a little bit with you. What are patient rights? How far does that go?
Tom, thanks for having me on. That's a lot to unpack. Let me work on it. No, it's great. I love the opportunity to be with you. And the wonderful thing about you as a doctor, having been a patient of yours now for some time, is you're such a good listener. By the way, I realize this isn't the Tom Rogers show, but you're such a good listener. And so I guess what I want to start to do is, yes, do you have a right to answer your question or just reaffirm that which we already know? You do have a right to refuse care or treatments or vaccines or whatever that is, even if it's harmful to you to refuse that care. So even if it's in your best interest to, I realize vaccines can be controversial. There are certain ones that I'm sure that we would all agree are necessary, and then there are others that are obviously very debatable. But let's pretend for a second it is something that we all can universally agree on. What's a good example of that, Tom? Not to put you on the spot, but what's a good example where someone needs an X and we know for sure any doctor would universally agree that that is the appropriate and correct thing to do?
Okay, say somebody comes in and they have an infection and they do not want to take an antibiotic.
Sure, so that's a great example. They would technically have a right to refuse that. Not just technically. I shouldn't say technically because that suggests that it's debatable. Yeah. They would have a right to refuse that, right? Mm-hmm. So so that is a patient right. Now, when it comes to vaccines, the same is true, or any other treatment, as we go towards less controversial, the antibiotic example, to more controversial, whatever it is, maybe a COVID vaccine, right?
Yeah.
So the question there, though, the wonderful thing about Tom Rogers is that you're going to listen and work through that, and you're going to coach me. And if I'm making a really dumb decision for my own health, you're going to say, now, Marcos, let's talk this through. Yeah. And because you've done such a good job of developing the relationship you have with me and your patients, I'm probably going to listen. You know, that old cliche that says people don't care about what you know until they know you care is so true, whether
Great
you're
statement.
a lawyer
Yeah.
or a doctor. And the
Yeah.
reason you're so effective, I would argue, is because it is clear that you care. You give a darn. And so I'm more likely to tell you, if Tom says take an antibiotic, I'm going to take an antibiotic.
Yeah, you're right. You know, I rarely have a problem convincing somebody what I would do. In my case, I would take the antibiotic if I really needed it. If it's going to be life-threatening. But there are other decisions like, should I take chemotherapy? I just went to my oncologist, and believe it or not, people come to me when, here I am, a family doctor, they come to me asking me, would you have this brain tumor removed? You know, they've already been to their neurosurgeon. They actually want my opinion on it, or whether they should take chemo. And the first thing I'll say is, look, I'm not a neurosurgeon. You know, I've never operated on a brain tumor. I'm not an oncologist. I don't prescribe chemotherapy. But let's talk this out, and let me look at the records, their recommendations, and what are they telling you? Are they telling you if you get this chemo, you may live for a year, but if you don't take the chemo, you're going to live for 6 months? And that's a hard decision for some people. You know, and here, by the way, here are the side effects of the chemo. And I'm not knocking chemo. It works in most cases, at least delays things. But there's a lot of side effects too. So it's my firm belief that that patient has a right to decide how they're going to proceed with a very serious problem. So we usually have a good talk about it and let them think on it and then see them back. They may change their mind. But a patient actually can refuse treatment, is what we're saying.
Absolutely. Now, you know, what's interesting, if we talk about the Tom Rogers scenario, it's, well, I'll show, along with that, a client, I say client because I'm a lawyer, we call them clients, you call them patients. They're not really
We're all just
different.
people. We're working toward the same goal.
Yeah, that's right. I mean, it's really, in fact, I'm sure you feel the same way. Isn't it unbelievable that people come in and see you, or in my case, see me with maybe one of the most important things going on in their life right now? I would argue health is always, just about always, top one or two. Usually someone with a legal problem or challenge or catastrophe that they're working through. That's usually, at that moment at least, is top one or
That
two.
can be life-changing, life-saving.
What
what
amazing
you're
thing
doing.
is that people trust you and I to we get to talk about those things with them and help them make good decisions. I think so. Point I'm going to come to though is that clients have a right to what's called informed consent too, which is I think that's sort of stilted language in a way, but this idea of informed consent, which I think is part of the bridge, the excellent thing, the thing that you do so well, is this informed consent piece, because the informed consent piece allows you to make that decision of refusal or acceptance of the treatment or the procedure. And what I think sometimes happens in the hospital setting, where hospitals, first of all, I start from the premise that most people, or all people, I'm gonna make the assumption that all people in a hospital are generally there because they want to help people. I know there are exceptions. There are exceptions everywhere. So I think we should start there and try to give folks the benefit of the doubt. On the other hand, what happens sometimes in hospitals is they are somewhat understaffed, or they have too many patients per nurse, per doctor, per whoever, and it's not necessarily that particular nurse's fault or doctor's fault, but they just have too much to do as good a job as they would like to do, or we would like for them to do. And so I think it's real important not to hate the doctor or the nurse. On the other hand, I think there's certain things you can do to get that informed consent to make that refusal or acceptance of treatment decision. And so that right to informed consent is, hey, I need to know more information. As a patient, you need to say, I need more information about this. Is there somebody on your staff who could come and explain that to me? You look very busy, Dr. So-and-so. Can you come back later and explain it to me. I want to think about this. And that's your right. There's sometimes this feel that a doctor who comes in and says, who hasn't done the, I'm going to demonstrate that I care about you by getting to know you, and then I'm going to recommend the treatment. They just come in and recommend the treatment because they're so compressed for time, they don't have the opportunity to get to know you, the patient, or your loved one, the patient. And so asking and utilizing those words, and you don't have to use the words, but if you say, hey, I need more information so I can make a good, informed consent decision, those sort of buzzwords, if you're a doctor and you hear, I need more informed consent or more information so I can make, you would pause if you're a busy doctor and say, oh, I may need to spend more time with this person. And along with that, Tom, I would say, and in fact, it's interesting, you mentioned this earlier. I was in the hospital not so long ago with one of my very best friends, helping them, and we called Tom Rogers for a second opinion, which, by the way, is another patient right. You've got a right to a second opinion.
Exactly right.
And none of us doctors or lawyers should be offended if someone wants a second
not at
opinion.
All. I'm never offended.
Yeah, I mean, I can't be right about everything. Maybe you could, Tom, but I can't.
Believe me, I'm not.
Someone say, yeah.
Sometimes a fresh set of eyes on a problem is always good, but you have that right for sure. And you, by the way, you did an amazing job with your friend and our colleague, another one of my patients. And if you hadn't been there in the hospital with him, I think he would have made a different wrong decision, maybe not to stay in the hospital overnight like you and I strongly urged him to do. Yeah. And it turned out great, but it's always good to me when you have to go to a hospital to have a patient advocate, whether that's your friend or your wife or one of your kids. Somebody needs to be there with you because mistakes get made. They are understaffed, they are busy, and mistakes get made. I tell people all the time, the three leading causes of death in this country, number 1 is heart disease, number 2 is cancer, number 3, right behind cancer, look it up, medical error. That is very common.
I would not have thought it was that high.
That is high. It's right. Look it up. It's number 3 cause of death in the United States is medical mistakes and error. Now, doctors are busy. They can make mistakes. That's why you need somebody double checking things. And you don't have to overdo it, but if you have a test they're going to run on you, you're not sure why they're doing it, you go, why are you running that test? What's the purpose of it? And they should have a good explanation. If there's no purpose to it, then why are you doing it? I do not practice medicine out of fear of getting a lawsuit. Knock on wood, in 38 years I've never been sued. But I do not practice in fear of a lawsuit. I think most doctors really do. And it makes them practice bad medicine, defensive medicine. They're too scared not to do this, because what'll happen if I get sued? I don't worry about that. All I'm worried about is taking care of that patient. And I've found that if you establish a good rapport, they know your care, they're not going to sue you anyway. Am I right about that?
That is 100% true. And I would say probably our practice is less than 1% medical malpractice. We just generally don't pursue that kind of case. They're very expensive, generally speaking. They're very hard to prosecute. And quite frankly, most doctors are just trying to do a good job. But the data says, some of my other med school buddies, they're like, the biggest thing when it comes to whether a doctor makes a mistake or not, people expect doctors not to be perfect. Yeah. But if they have good bedside manner, then that is probably the biggest barrier to someone choosing to sue a doctor. And quite frankly, just personally, if you there's to sue a doctor, first of all, is a very big deal, right? To sue anybody is a big deal, but someone with a professional license who generally is in a helping profession. The other is there are quite a few obstacles in place, which are probably arguably good. I mean, you have to go hire an expert. Mm-hmm. You have to declare under oath that this is an actual case, that someone did amputate the wrong leg or whatever it is, something that And you have to spend an awful lot of money, which is probably appropriate, to get an expert to say, gosh, was this really a mistake or a problem or medical malpractice? And then you also probably, it costs not just thousands, probably tens of thousands, even hundreds of thousands of dollars to sue a medical care provider. So, that's one thing that's interesting. Some of my doctor buddies, I'm like, the idea that you should worry about litigation is silly. First of all, that's what insurance is for, number one.
Yeah.
Two, and
Right.
again, not that insurance solves all problems, but we all have to have it as professionals anyway.
have to have it.
The second thing is there are so many hurdles to get over to effectively sue a doctor. If you really just pulled all that back, and this is what I hear you saying in so many words, and just focus on giving the best care you can, the rest of that takes care of itself. There's no need to practice defensive medicine. Just practice the best darn medicine you can, and the rest of it takes care of itself. Because as an attorney who engages in suing folks from time to time, and plaintiff's law they call it, I'm not interested in, if someone walked in and they amputated the wrong leg, I would take that case, right? Because that's a clear mistake. And I'm sure the doctor who did the mistake would understand and say, yeah, that's what my insurance is for. But outside of that, those cases just aren't, they're just too hard because most doctors are just trying to do the right thing. So anyway, it's interesting. I feel like I've got a little bit off topic here with you, but
Patient rights, even simple. So I am a believer, when you go in the hospital, if there's any way you can, please have a family member or a good friend go in there with you and look over you the whole time if you can, because the care can be so spotty because they're understaffed. Like you say, it's not their fault, but somebody double checking on you, like the nurse is hanging the new IV or getting your medicine. What is that you're giving them right now? I'm curious. What is that? And I want dialogue. This is the imipentin antibiotic we're giving this patient right now. This is something to help them relax called diazepam. I really want to know, because if it's that one out of a million terrible, life-threatening mistakes, then I'd ask a question, is what they're doing.
Well, I think because most of us have so much respect for doctors, we assume that they are making the best decisions for us. And I think they often are, almost always are trying to. I do think a real valuable question, and I think this tool works so well in treatment, is, to your point, I think try to have somebody there with you that can help you advocate, because they also are making observations about your appearance, your symptomology, and things that they can convey to that doctor that you can't perceive about yourself, mainly because you might be in some stress or in a hard situation. The other is, sometimes too, when we say have right to refuse, my only fear is some of us and our close friends are like, I heard from Tom and Marcos that I've got a right to refuse. I don't want this, I'm refusing. And sometimes it's nice to have that person who you respect to sit there with you and say, I understand you've got a right to refuse, but you really, let's talk about this. And one of the most magical questions, I think, both as a doctor or lawyer to a patient or client, and also as a client to a doctor, is why, right? And
Why?
not in a confrontational or aggressive or mean way. I still think you want to kill your nurses and your doctors with kindness, because you're going to get better care if you're kind to people. They're going to want to deal with you more.
Doubt.
But in a kind way, can you say, you're going to give me some diazepam? I understand, and by the way, I'm not second-guessing you, doctor, although sometimes maybe you are a little bit, right? But I'm not second-guessing you, doctor, but why? I'm just curious, right? And if they can't answer a question why, then that might throw up a red flag for you. But I think just the simple question, why are we doing this, really creates dialogue that not only gives you some information, and as a patient in the moment, that information also removes uncertainty. And we've talked about this before. That uncertainty is what just stresses people out and makes us all unhealthy.
Not knowing. Yeah, that's why you're scared when you get in the
why,
hospital. That's scary times.
And if I say, why, Tom, and you give me an explanation, at least I'm like, oh, okay. And once I understand, heck, I can relax a little bit more. So.
When you go into the hospital, have you ever noticed how many forms you have to sign? I mean, if you really had time to read all those, you'd probably be shocked. So it's not a bad idea to have your advocate go over those with you. You know.
Yes, and so that my question about that for you, actually, I've got an answer to that, I think, but I don't know. And a lot of people have this perception that lawyers read every single bit of legal information. I can't tell you the last time I read an entire document. Maybe this is not good to admit. That on behalf of myself,
Sure.
On a client, sure. You know, if you're Tom was entering into a contract, I'd read every word and pick it apart. When it comes to my own medical care, I just walk in and sign it all because usually I want the treatment and I'd rather have it sooner rather than later. And this is my obstacle. So I think 90-something% of us just sign all that stuff, whether it's for ourselves or I was just in the hospital with my son. He had a bicycle accident and a head injury, and I signed all those documents. I couldn't tell which one of them said what because we want the treatment.
Yeah.
And so I don't know that I would say, oh, you got to read everything because I mean, you should, but it's probably not practical.
Yep. Yep.
What I would tell you, though, one tool is all of us, one of our other patients' rights is the right to revoke. A right to revoke permission or care to do something or a procedure. We all have a right to revoke. And so you could sign all the paperwork. And again, I should tell you to read it all. There's probably someone out there that says, why are you telling people just to sign it, Marcos? I'm just realistic about life. Most of us are just going to sign that stuff because we want the care. My son's, I was worried he could have a brain bleed. Yeah. I'm going to sign the stuff because I need the CT scan sooner rather than later.
Yeah. You're sitting there bleeding and you want to sign.
Yeah.
Because otherwise they're not going to take you back.
But at some point, if they were going to exercise this or they said, no, but you signed here, the response to that is, and do it politely, I hereby revoke.
That is such a
agreement
good,
or consent.
That's such a good pointer. Because you may be there for a day or two, you realize I'm not getting the care that I think I should be getting. You're going to revoke that. That's
Absolutely.
A great point that most people would not know. They think once you sign something, it's done.
Yeah, once I've signed my life away already, I can't do anything about that. That might be true with the military, right? If it's military service, that's a contract that's really hard to get out of.
Yeah.
But when it comes to medical care, you've got an absolute right to revoke whatever it is you've agreed to.
That's a great point.
And if they say, well, we don't have paperwork for that, I don't have a contract that, hand me the document I originally signed, and you could write on it, I hereby revoke, sincerely, Tom Rogers. And that would be valid.
Right. Because of COVID and censorship and misinformation and controversy and what I call widespread panic that happened and it occurred, and more of a control thing that a lot of people took on that situation, I think a lot of people kind of woke up and decided, hey, I'm kind of doubting things now because of what transpired, i.e. vaccinations, mask, distancing. I mean, I hate to say it, but our government lied to us a lot. They'll tell you now they lied in a lot of cases. They based the masking, the distancing on no scientific basis whatsoever. And now when you look back at what happened, they were wrong. They will tell you that. Even the CDC was wrong. And so it really put in a lot of people's minds, gosh, I just don't trust the medical establishment nowadays. I don't trust the FDA. I don't trust the CDC. Now, those are statements that are hard to believe, and overall, I think they try to help us out. But boy, it really brought to mind that, golly, I want to make my own decision about whether or not I want to take that shot or not. And it's my right to refuse it. It really became terrible with a lot of companies and of course I see a lot of vaccine injuries. I'm seeing the stuff that most people don't see. And again, it's not that common, but if you're that 1 out of 1,000 people that it has a major adverse effect, and you were young and you would have gotten rid of the virus anyway. It was 99.8% survivable anyway. You start getting real bitter. I see patients like that all the time. that there's no doubt that's what caused it. But for the overall population, may not have been so bad.
Tom, the interesting thing about that is, and maybe I try too hard to simplify some things, but if you think about the information we got, and a lot of it was either not correct information or misinformation. I think that, we were talking earlier, I think, about how uncertainty is what really hurts everybody and hinders us all. And what created that panic, I think, was the lack of certainty about the information we're getting, right? Mm-hmm. And once you start giving, no information is hard to deal with. But if the worst thing, even worse than no information, is misinformation. And so if you get the wrong information, then that's what creates that sort of uncertainty, which has kind of caused us all to become a little bit more critical of healthcare, I think, generally, which may not be, I want to take a positive spin on that and say, I don't know if that's a bad thing. It is good that we should all be asking that why question. Yeah. And so I think that's one thing, if we're going to take a silver lining out of this, which heck, might as well try, right? Is I think we're all a little bit more aware or a little bit more alert that just because someone's recommending it, is it really good for us? Now, I think it's made, on behalf of doctors, it's probably made giving care a little bit more challenging and more difficult. And I hate that for doctors, because I think all of them are very well intentioning. Obviously there's exceptions to everything, but sure. I think it has increased our ability and our awareness that we do need to ask, why are you giving me this treatment or this particular vaccine? And then the follow-up question to why, if you can remember nothing about this podcast other than whatever Tom says, and then why as the question. But the next question is, why are we giving it? And then the follow-up question to why is, what if I didn't do it? Yeah. Right? What's the risk?
What's the
of
harm?
not
Are you going to
it?
hurt other people by not doing it? Yeah. When they knew from the onset that vaccination did not cause spread. In other words, it did not prevent the spread. There's no way it did. And everybody knows that now. So that was a lot of misinformation. And so patient rights got really downgraded. I think that's why people are starting to think now, what are my rights now? What do I have to do? And it was amazing to me how it tore families apart. You have some extreme anti-vaxxer, and then you have somebody who bought every bit of the narrative and went overboard with that, and it actually tore families apart. We don't want you to come to our house, because you haven't been vaccinated. It's funny, because in my office, I had people that both ways. They would call up, I'd like to make an appointment with Dr. Rogers. Has anybody in your medical staff been vaccinated? And they would say, yeah, some did, some didn't. Well, I'm not going to come in then. I won't come into a place where anybody's had a vaccine. And then we had other patients that would say, has everybody on your staff been vaccinated? No. Well, I won't come into your office then. Isn't that hard to believe?
It is, and it's sad, right? I'm sitting here thinking about, what to pull out of that as well. And one thing that occurs to me too is, when we're talking about patient rights earlier and continue to talk about that, one thing that is in the patient rights, and we don't talk about this very often. One is the right to confidentiality and privacy. Most of us are very familiar with that because of HIPAA. HIPAA is, for good reason, is very very common to discuss and to know about. And we all have a right to privacy and confidentiality, which is very important, of course. The other thing, though, that we don't talk about nearly as much is you do have the right to accept or refuse treatment, but you also have a right of no retaliation. And so that's another thing that's built into your patient's rights, is that you should ask for informed consent. And that's the funny thing about this COVID thing, the vaccine. I know there's a lot of information going back and forth, and it was very divisive, but at the end of the day, what you really want is informed consent, and then the patient to make a decision based on that informed consent, and then we should respect that person's decision, whether we agree with it or not. We don't respect loved ones who who will not take an antibiotic for something that an infection, right? Mm-hmm. That's something we have a hard time respecting, but patient rights say we have to respect that decision. Mm-hmm. Mm-hmm. Even the ones that we in our heart feel are dumb, we have to respect them. And treatment providers have an obligation to respect that. So if you're having a scenario and you are either accepting or refusing treatment and you feel like you're getting some sort of blowback from a nurse or a doctor or practitioner, that is a violation of patients' rights, because you've got a right to that informed dissent. You've got a right to make your own decision about your own care. I would, as you've suggested, have somebody there to help you with that decision, because two heads are better than one, I mean, as the saying goes. And then whatever that decision is, you also have a right not to be retaliated against because of that decision. Mm-hmm. And that's part of patients' rights.
Do you think some of that happened?
I do.
I do too.
Yeah, and I hate it, and I just, I try to look at things, this is not legal or medical advice, right? But I always try to reverse roles with the other side. Mm-hmm. If you can just try to reverse roles and try to see it from their perspective, even if you disagree or think the decision or the point of view is dumb, why is it they feel strongly about that? Let me pretend to be Tom for a second. What is Tom thinking? Or how do I grab a hold of whatever it is that makes him want to retaliate? But at the end of the day, and that might help you to pull Tom or treatment professional around and say, hey, I really feel like you're not respecting the decision me or my family have made, and I feel it's somewhat retaliatory. Mm-hmm. And again, we shouldn't accuse everyone of retaliation. We should try to, let's start with what is the, let me give this person the benefit of the doubt, but if you feel like you're being retaliated against, sometimes just saying, hey, I'm just here to get care. I feel like my decision hasn't been respected or I'm being retaliated against. And I don't, the best way to say that, if you say that in a nice way, I mean, that would stop you in your tracks, right? If you were giving me the business about what I ought to do or not, I said, Tom, I just feel like you're not respecting my position. It feels somewhat retaliatory. What would you do?
That's when you get that second opinion.
Yeah, that's right. Yeah.
Switch doctors, because it's certainly your right to switch doctors. Yeah. I tell people that all the time. If your doctor is not treating you like you think you should be treated and just throwing medicines at you, or really not getting to know you and respect your own decisions, find a new doctor. That's not hard to do. But also remember that the patient is actually paying us as doctors. They're our customers. We want to take care of them. And they're different. Everybody walks in their different shoes. You don't know that patient's experience. You don't know that their father died because they were given a wrong injection. Those people have fears. And everybody has the right to live their life like they want to, as long as it doesn't harm another person, and certainly with the COVID deal, it didn't harm another person because you didn't take that vaccine. It didn't make a difference at all, it turns out. Yeah. So there was a lot of censorship, a lot of misinformation, and not to get off on vaccines too much, but I think it did bring to light the fact that people are not so trusting anymore, which is a shame, because you really want to trust your physician, to make the right decision. But there's a lot of times that mainstream medicine doesn't look outside the box. A lot of times that cognitive dissonance that we talk about, the refusal to incorporate new research that we know that was wrong. We did that wrong. I tell people all the time, what we're doing now in medicine, about half of it we're going to be doing in 5 years. The other half we won't be doing because it wasn't effective. The only problem is we don't know which half it is.
The thing that's interesting about that too is, I guess all of us have varying degrees of needing to be right about stuff. And what's interesting about that, and I love your perspective in that, you're like, look, I'm giving the best advice I can, the best informed advice. I try to keep informed. And then what's the kind of funny and somewhat ironic, maybe a little scary in some ways, is 10 years from now, we'll probably look at some of these treatments and say, oh my gosh, we did that back in 2024. That's madness. And so I don't know what it is about, not to get too philosophical, but I don't know what it is about us where we need to be right so badly that we can't change our minds or incorporate new information. I mean, I hate the fact that so many families and people got torn about over vaccines. And at the end of the day, people were just really wanted to do the right thing, whatever that right thing was.
That's exactly right.
And it's I guess kind of sad. One thing I do want to talk about too, Tom, is I feel like sometimes as a lawyer when I say, well, you've got a right to refuse, you've got a right to ask why, you've got a right to informed consent, you've got a right to revoke, all those rights, I do want to empower people or let them know, that knowledge is power. And then on the other hand, I also always want to sort of buttress that with, gosh, but sometimes you aren't doing the thing that's best for yourself, right? Mm-hmm. And you don't have the perspective that you need. So I think and you touched on this slightly earlier, is if you can just have somebody with you, and I know it's not always possible, and some of us sadly are more alone than others, but if you can just have a friend or family member that you trust and care about with you as much as possible while you're getting care, they can, one, observe your symptoms, two, they can advocate for you, two, they can help process, or maybe as a patient, often you're in a very stressful situation, so you're not taking in all the information, and so that second set of ears can help grab some of those nuggets or some of that information that you might not have caught on first pass due to the distress that you're in. And so I think that's a really moving into I think it's really important to identify those handful of people in your life that you're like, this is the person I would want to come to my bedside and help me advocate for myself, because I realize I'm not always going to make the very best decisions for myself. Who am I comfortable processing this information with, who also could be an advocate to this doctor and give that doctor more information that they can make a better decision? Because a lot of times doctors don't make mistakes because they don't have all the information and the time to get that information.
Yeah. That's a great point that you just made. Kind of like we talked about last week, picking out somebody who's going to help make decisions for end of life decisions. But it's a great idea to pick out somebody now that you want to be your patient advocate when you're hospitalized. So start thinking about it and ask them, hey, if I'm in a hospital, would you come look over things a little bit? As a trusted family member or friend. I mean, certainly you spent hours in the ER with your friend, and it really helped him make a major decision. Potentially a life-threatening decision, to stay and go ahead and get the test.
Yeah,
I don't
the
think
data.
he really wanted it, but he was grateful in the end for your care. But the thing you mentioned a minute ago about what I call cognitive dissonance, I talk about it all the time. Doctors are the worst at it because they're used to practicing like they did 30 years ago in their residency. They do it the same way. They're strong-headed. They don't want to change. This is the way I've always done it. This is the way we've done it. And I read a good book about that recently, which I'll link into. It's called Blind Spots by Dr. Marty Makary. He's a surgeon at Johns Hopkins. He's one of the most well-published doctors in the world ever. Read the book Blind Spots. It'll really open your eyes a lot about how some of the stuff we've been talking about you need to start looking at, because it's your decision, and look at the evidence. But there's another thing I want to link up here, was your list you brought me of things that patients need to see as far as advocacy, and you did a lot of research for me on this podcast that I want to print down for people to have a list of it, because it's very good and it's very important. But this has been a great discussion. It'll be an ongoing discussion, and I certainly appreciate you coming in here and being honest with us about the legal sides and patient rights and advocacy. All this stuff you mentioned is so important.
One thing too, Tom, if I could say one more thing. One thing you're talking about when you talk about blind spots, I'm always looking sort of this for the transferable concept. One thing I was worried about was, by giving folks, hey, these are your rights, I can refuse anything I want, that you might make a bad decision, because what you want and what you need are often different. We would agree.
Right.
And then when you talk about sometimes doctors on the other side, if we reverse roles with them, one thing, we talked about how uncertainty is so hard on people. Change is also really hard on people. That's one of those universal concepts that's hard on us all. And so doctors, because turns out doctors are human beings, struggle with change as well, right? And so sometimes what they're used to doing for everyone may not work for Tom Rogers on this day under this circumstance. And if you think about it, all of that is kind of encapsulated, blind spots, the fact that can sometimes happen with doctors who are really smart and are used to being right, because they usually are right? Same with patients who, well, I've got these rights now, I'm going to exercise them, and when really that may be what they want, but not really what they need, and hopefully they've got that person there with them, but that person with them is really like a coach, right? And what we're really talking about with these doctors that sometimes, and all humanity, I don't mean to single out doctors, lawyers do the same thing, they are used to doing it a certain way because 90% of the time that is the right solution under this circumstance. But one thing we talk about in our sort of my day job in our office is, gosh, whatever our age is, whatever we are, whatever our role is, if we can all do nothing more in this entire world but remain coachable, then we've got a good chance at being good spouses, at being good children, at being good parents, at being good doctors, at being good lawyers. And so what you're really speaking to, I think, is, gosh, if doctors can just remain coachable, even though they generally have a knowledge advantage.
Right.
If we as patients, even though we understand we have rights to exercise, if we can just remain coachable either with our doctors or with our friend or the person that we designate with a medical power of attorney to help us make decisions if we are not in a good spot, if we can all just remain coachable, man, we got a really good chance of making good healthcare decisions and otherwise.
I love the way you put that. Be coachable, and that's what we are as attorneys or we're coaches.
Yeah.
You know?
Well, and then also I like to challenge folks. We're coaches, and then the other is it? And I know you are because I know you so well. Is it bilateral or is it unilateral? And what I mean is, you and I do a lot of coaching. What I'd like to say, and what we should continually remind ourselves with, although I think you come by this naturally, is, are you still coachable? Am I still coachable?
Yep.
Yeah.
I knew you were going to say that.
Yeah.
Are we coachable? Because we need to be.
Yeah, have to be, right? To
we
make the best
have
decisions.
to be coachable. So that's such a great point, Marcos. And I really appreciate you coming in and doing all this. We've had a good, long discussion, a couple weeks worth of it. And I certainly trust you, and you're a fantastic person, fantastic attorney and friend. And I can't say enough about how much this means to me to have a guy of your stature in here doing a podcast with me. Thank you so much.
Thank you. It's an honor. Thank you.
We'll see you. Thank you so much. We'll see you guys next week.